Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric OKelly. This week, we are again joined by Sam Coffman, who is a former Special Forces medic. He created the Herbal Medics Academy, where he teaches wilderness first responder and austere medicine, as well as herbal medicine. Sam, welcome back to the program.
Thank you, Aebhric. It's really great to be here. Glad to talk to you.
So tell us a bit about yourself and what's been keeping you busy.
Sure. We've moved the campus up to Taos, New Mexico. So we're in northern New Mexico. We're in the mountains, just a few, 10 minutes or so away from downtown Taos, bordering about 500,000 acres of national forest, which gives us a really big kind of playground for our outdoor classes. And then, of course, we've kind of tightened up our online program a lot. And so we have a really extensive online program that's also extremely interactive, with live Q&A all the time between myself and all of our faculty. So we have 2 MDs and a NP and a couple of RNs, 1 RN midwife and a licensed midwife are all part of our faculty that we present and create all this curriculum with amongst our 5 programs. All of that has kind of gotten more organized, over the last, since we last talked, probably.
Fantastic to hear. Since we talked, you published a book called Survival Gardening. And in that book, you describe how to grow your food. And you started the book with quick growing sprouts and then ended at the end with how to grow annual rotation crops. So tell us a bit about that book.
Sure. That idea, as you know, that was my second book through Story Publishing, the first one being Herbal Medic. And this one really, they asked me, hey, so we've covered a lot of herbal medicine and so forth in the field, but what about food? How do we deal with food? And so my idea behind it was, if we had to, let's say that the lights went out and we had to live off of what we grew, and you're in an area where you run out of food in the first week or so, everything's looted or just gone. You don't have distribution, whatever. How would this look? And so what I thought was, okay, let's talk about like the first 5 days, the first 5 weeks, the first 5 months, the first 5 years of that. What does that look like? So we're actually, what is out there that would give us enough, at least micronutrients, hopefully as much as we can of macronutrients of our protein and fats and carbs and calories to be able to sustain us. And that starts literally with sprouts and with starting to grow mushrooms and with microgreens and so forth. So stepping into it from the standpoint of, what if we had to live off of at least the majority of what we needed to live off of had to be what we grew. And this, of course, includes even, as we get into it a little further on, eating insects and garden pests, and of course, all of the wild foraging and just, weeds are some of our best medicine and they're also some of our best food. We just don't know that and we don't use it. But we're going to find a lot of times weeds in our garden are actually better food. Well, I'll give you an example. This year, we're still using raised beds up in Taos. It's, we're at 7,800 feet. It's a little different than growing in the San Antonio area where we were before in terms of growing season and so forth. So everything's raised beds as we kind of get soil slowly worked up and in better condition. But as an example, this year, I think we probably, at least in the first month of our harvest, we probably had more amaranth and lamb's quarter and purslane available in terms of actual calories we were getting from the garden than we did a lot of our food that hadn't yet bloomed. So, your wild foods and your wild weeds, quote unquote, are going to be a big part of that as well.
So you wrote that book for a grid down type of situation where you, due to a hurricane or due to just not having access to a grocery store anymore. And it makes perfect sense that you can do something with the first 5 days and then slowly build up till 5 years, as you said. And I read that and immediately I saw the applicability for resistance healthcare, or you and I, as old SF guys, we learned this as unconventional warfare, UW, and now it's called MSIW, the medical support for irregular warfare. And your book is a perfect example of what the guerrilla ICU needs to provide food and medicine for this clinic in the middle of nowhere, and it can't be found, and it's only accessible by the local guerrilla combatants.
That's right. Yeah, I think the entire idea of unconventional warfare or any kind of a situation where you really don't know from day to day or from week to week what the situation is going to be, and you're trying to run some sort of a medical clinic or an ICU in it, you really have to be able to think on your feet and adapt and Of course, wild food and wild medicine absolutely becomes a part of the sustainability of that kind of a situation, of course.
So you and I had a chat about this concept, and we saw that there's more than one podcast episode with this. So what we're going to do is we have created a 3 podcast series on MSIW and the herbal needs, the guerrilla gardening needs for a resistance healthcare clinic. And this first episode will discuss a bit about what we learned on unconventional warfare ICU, or now it's called Guerrilla or MSIW. We as Green Berets, that's one of our things. We have 6 missions, and one of these is this particular mission for I guess it would be under unconventional warfare or foreign internal defense. So the soft medic needs to learn to create a healthcare clinic in a resistance, semi-permissive environment, and they need to have medical supplies, so they run out. My question for you, Sam, can we supplement our medical supplies with local plants?
Yes. And that's not just, I'm not talking from theory here. That's my experience. And that's what I set out to really kind of do literally over 30 years ago. I got out 95. And even prior to that, I was already kind of part-time starting a survival school that was also focused heavily on herbal medicine. But I had a little herb kit that I had in my med bag, right? For me personally. And so, you know how it is. You got a 100-pound rucksack, and out of that, as a medic, probably 35 pounds of that is your medicine. And out of that, the supply sergeant at the time was throwing away these things and a big pile of stuff. And I found these, what I didn't know at the time, but now I found out it's like a fly tying kit. And so it was like a hard shell with glass vials in it. And so I was able to put my herbs in there. And so I was using those herbs then, and it was keeping me healthy. The funny thing was that I had teammates, especially other medics, and also from other teams, that were saying, "Hey, man, how come you never, you didn't get sick, or you didn't, and I was kind of at the top. I was really good with languages. I have a linguistics degree as my undergrad degree, and I was in top physical form back then. I mean, I was probably in the top 5% physically, and I'm not bragging, I just was. And so I think everybody thought, wow, I want to be able to do what he's doing, and he's taking herbs. People were coming up and asking me what herbs I was able to learn, how I was able to memorize stuff so easily and remember all the medic stuff. And back at the time, I probably had a very limited materia medica of maybe 20 or 30 herbs that I knew. But, I was taking ginkgo biloba, and they wanted to take that. And then I even started to get to be where, hey, my family's kind of is getting the flu. You have anything you could use? And those were my first clients, really, were fellow teammates. And if we were on training, we had downtime. I had other medics come up saying, "Hey, can you take us on a plant walk?" And that's when I really started to realize how much we needed this from a very practical standpoint. We needed this sustainable medicine. And then that grew into my school and my outreach organization, Herbal Medics. And we've been in the middle of, like I've mentioned to you before, in the middle of the jungle, 100 miles from any road, doing herbal clinics, doing slow sand water filtration, creating a healthier environment, and basically health all the way from, the water and the food, all the way up, of course, to the medicine, and watching it work. And I've done that, in some of the most underserved areas in the U.S., Native American nations, post-disaster relief. We've done it in Nicaragua. We've done it in Mexico. We've done it in places where there's no medicine. It's, my point is, I've treated thousands and thousands and thousands of people with herbs over the last 3 decades. It's absolutely effective, both from an acute standpoint, from a chronic standpoint, and even to a minor degree for trauma, certainly for post-trauma healing and infection and wound management care. It's all a very practical and sustainable solution that I feel should be a part of special operations medicine.
And you have a master's degree in herbal medicine. It's Chinese medicine as well. Is that right? Acupuncture.
That's right. I have a Master of Science in acupuncture and Oriental medicine, so I'm a licensed acupuncturist as well. And so I've integrated over time as well the TCM herbs. Now, I started doing that from a Western perspective, probably 12 years ago. And the reason was because that's where all the research was. You couldn't find good research in the U.S. on plants, but you can find it in China, you can find it in India, you can even find it in Europe. And the reason for this is because it's done from a different perspective. In China, these herbs have been used for millennia, over millions, maybe billions of patients. And so empirically, they're saying, hey, we can observe that this works, but how does it work? And that's kind of the mentality the research starts from. As an example, one of the first herbs that I first started working with was ashwagandha from a standpoint of neuroregenerative medicine. And the reason I did was because of In India, they did this research with ashwagandha, using it, like infusing it into an oil. It's called a nasya oil. It's spelled Nasya. It's an Ayurvedic concept. And so you infuse this oil and then you rub it into the membranes deep in the nose and gets it across, of course, directly into circulation as directly without going through first pass detox or through the gut. And they're finding that it's reversing or at least completely halting early onset Alzheimer's and dementia type cognitive function. And so this was this big research that they did. And I remember like 100 patients and 100 control. And it was like really, really fantastic. And I thought, wow, I started researching it and realizing, okay, there are herbs out there that actually repair or help heal myelin sheath around our nervous system, around our nerve cells. And so that damage, that inflammatory damage is, in my opinion, related to things like long COVID. It's related to stress over time. It's related to all kinds of different issues that we see later on as what you could imagine from inflammation of the nervous system, right? And all the things that can come off of that. They could literally be symptoms that don't have anything to do with what we might think of being, it could be gut stuff going on that's related originally to nervous system issues. And so I started researching and found about a half a dozen to maybe 10 different herbs in TCM that had also been researched that help restore myelin sheath and repair. And so that became kind of the first TCM herbs that I started using, but it was not from a standpoint of TCM at all, because it was really done more from that reductionist idea of Western medicine. So there's a huge gap between those two worlds, right? I mean, how plants actually work, because you have to remember a plant has thousands and thousands of constituents. It's not a single compound. It's not a single pharmaceutical compound, but we use this language of single pharmaceutical compound to describe it. And so it's like kind of trying to use a language that doesn't quite fit, So TCM has really helped me with that a lot as well, the traditional Chinese medicine.
So Sam, how would you suggest an 18 Delta or 68 whiskey and Slocum to implement the science of herbal medicine into the science of what we're doing with Western medicine?
I think the biggest bang for the buck you're going to get on that is acute care. There's some things that herbs do that pharmaceuticals just straight up don't do. So finding those little niches where our herbs work really well. And one example of that would be a lot of different viral infections, whether we're talking URI, upper respiratory tract infections, whether we're talking herpes family viruses, whether we're talking any, general viral infection type stuff. You're going to find better results, in my experience, with herbal formulas that can do everything from slowing down and even stopping virus shedding to really repairing and restoring the tissue. And, the terrain kind of approach to health, restoring that tissue, restoring the mucosa. So those particular niches are really easy for anybody to jump into and be really good at. I always say, if you want to be really good at herbs really fast, there's 3 things you need to learn to do, and they're very easy to learn to do. One of them is moving the lymph, being able to stimulate and move the immune system and help our immune system. And by this, I even mean like the submucosal, the lymph and immune system that we find submucosally, especially in the upper respiratory tract. The second is the mucosa itself. How to support the mucosa. And there are so many herbs that do an incredible job at doing this. And again, probably because they also stimulate some of our immune system, our submucosal immune system. And then the third is learning to support the liver and the digestive tract through the liver. And that is also a really low-hanging fruit, because there's so many herbs that do this. And you can, even though it's not maybe a long-term solution, it's more of a short-term solution, just by helping liver function, you can help so many issues that are out there that may even be more chronic, in sense that, IBS and GERD and even blood sugar issues can all be greatly helped through support of the liver using herbs too. So those are kind of the 3, I would say, from a standpoint of the, physiological Western breakdown of the body, a Western breakdown of the human body. I would say those are kind of the 3 of the big low-hanging fruits.
So we're discussing the concept of using your science, of using your herbal remedies to enhance a guerrilla ICU with locally found herbs for food and medicine, or harvesting herbs and plants at a certain time and keeping them for protein for food as well as medicines. And over the next 3 episodes, we're going to be focusing on that. And the next episode, we have a full episode on just the food aspect, the protein. So we need to provide food for the medics and the local resistance, as well as food and sustenance for convalescing ICU patient in this forest hillside that's our Guerrilla ICU. So, and then the third episode, we'll be talking just about the medicines and the science behind a lot of what we can find in, well, looking here in Europe or in America in the temperate zones on what type of locally procured options are available. And we'll do a deep dive on the next two episodes on that. But for just the big broad strokes, you're talking about three options for the soft medic or the guerrilla medic, the resistance healthcare provider to get herbal options for medicines. What about food? So next episode we'll talk about food, but what would you suggest for easy access for food? So your book is first 5 days, what can you have? First 5 months, what can you have? First 5 years, what can you have? For in those first 5 days, what can that Guerrilla ICU find locally that would be sustenance for themselves?
Yeah, and of course that depends on the zone, the temperate zone you're in, and the time of year, obviously. We aren't able to get food, if it's not available. And that's the whole idea behind preparing and storing food, right? Yeah, and then of course growing and preparing and food as we became an agricultural society, whatever, 10,000 years ago. This is an interesting side note here. I've read the statistic, and I don't know if it's true or not, that if you took all the wheat and all the rice that we've ever grown as an agricultural society and you put it into one pile, and you took all the acorns that our species has ever eaten since the beginning of our species, that the acorn pile would still be about twice the size of the wheat and the rice together. No, so when you say, first of all, the biggest issue around eating wild food, really, in terms of nutrients for our body, is macronutrients. It's getting enough calories. To get 2,000 or 2,500 or whatever calories a day is not easy to do without meat. If you had insects in there, you could absolutely do that. But then catching, harvesting, and doing all that with insects is more time consuming, and it's more difficult unless you have some, specific types of insects that you're good at getting, or you have maybe a huge, locust invasion or something like that, right? Or grasshoppers everywhere. Then it becomes easier, but, it's not an easy food to catch, which is why we, rely on meats, of course. So that's probably the biggest issue that you're going to run up against is how do you actually get the caloric intake? Now, micronutrients, no problem. You're going to get far and away more micronutrients from any foraged wild food, quote unquote wild food. And this includes weeds, which grow, incredibly and everywhere, especially in gardens where there's good soil or where there's disturbed soil. You're going to get lots and lots of micronutrients. But where we're going to have to turn for protein and enough calories that way are going to be things like acorn, of course. They're going to be things like seeds and berry type parts of plants where we're going to get that. So, for instance, hackberry seeds or any of the amaranth seeds or curly dock seeds are going to give us substantial amount of protein, even mesquite beans to some extent. Maybe not quite as much, but you're going to get enough protein that you could live off of it for a while by grinding it and turning it into flour and so forth. And we do that. Like in our school, we've done that for years and years and years. And you can actually get some really tasty stuff there, right? And of course, all the nuts, right? So pecans and so forth. Getting those in the harvest, being able to harvest those is a whole nother question, right? So if it's winter and you're in the Midwest or the North or Maine or something, you're going to have a much harder time, obviously, with this than in the summer down in the, let's say, San Antonio area, or something like that, where you're in a nice kind of subtropical area where there's lots of food. And of course, once you get down into the tropics, it's a whole nother world and you're going to have year-round food. But that's kind of a different topic, I think. That's sort of, again, literally, no pun intended, the low-hanging fruit. So that's the biggest issue that we're up against. So in my book, first 5 days, first 5 weeks and so forth, the first thing that we're starting off with, we're assuming that you don't have the ability to just go out and forage everything, but we're also assuming that you may have the ability to grow something from seed. And so we're talking about sprouts, because sprouts do give us maybe not a ton of macronutrients that we need and all the caloric intake we need, but they're not bad. And they certainly give us a lot of micronutrient as well. That we're going to be able to use. So sprouts is kind of the first step. Mushrooms, of course, can be something that we grow relatively quickly in the first 5 weeks, depending on the mushroom. And then as we get into microgreens and going from there, and we're able to have enough time to be able to grow a lot of root vegetables, we're going to start getting at least a lot of carbohydrates and sometimes some proteins in there too.
I learned from the Tracker School in New Jersey that the pine needle tea is high in vitamin C, and you can use it for, it's not macronutrients, but You can use it for a lovely tea. But the nettle, the stinging nettle, has protein. And we were taught how to harvest the stinging nettle without getting stung. And you grab the top of the nettle leaf, you fold it over on itself, so you never touch the underside, and you keep folding it over and you squish it, and you can eat it raw. I had some just last week, and they grow 7 months of the year, 8 months of the year, and it's a high protein option.
Yeah, so nettles are, of course, amazing, and the leaf, and of course, they're amazing medicine as well. The part that you want to eat generally is the leaf, and we can treat it just like spinach. And like you said, yeah, you can squish them from the outside in, and you don't get the acetylcholine, the effect of the needles. But and they're one of many. I would say that if maybe even growing more abundantly along roadsides and in any kind of broken up area, you're probably going to find like your pigweed, your amaranth, and your lamb quarter are going to be probably more prevalent, and also very relatively high in protein for just the leaf itself, for instance. Now, there's a lot of roots out there too that are going to give us salsify root. Okay, so back when I was first starting, my first version of this school was 34 years ago or whenever that was. I would test myself and my foraging abilities by just taking out nothing. I had an elk skin, I had a canteen cup, and I had a knife. And that's what I would allow myself. And I'd go out and I'd live out in the Pikes Peak wilderness. And this was during the summer and the fall months. And I would do it for anywhere from 3 days to 3 weeks at a time. And I would get pretty hungry, but I really started to learn my foraging and how I was doing that, and salsify root and even thistle root to some extent. You got to be careful how much you eat of it, because it's a very strong digestive and liver stimulant, no matter what species you're eating of that. But the salsify root, I remember, which kind of looks like a large dandelion, is everywhere. Those were a couple of things I felt like I got a lot of. And then the Gamble oak in the Colorado mountains and even the New Mexico mountains, you can eat those acorns raw without having to leach them. They're just not. That's a whole other topic about the astringency and the number of tannins in acorns versus our taste buds from one species of acorn to another. But some acorns you don't really need to leach, not very much anyway, and you can eat them raw or close to raw. You can leach them maybe once, as opposed to having to spend a whole bunch of time doing that. And that gives you an immense amount of protein as well. Again, any of the nuts, right, that we can get in the wild are going to give us the fats and proteins we need too.
Another one is the catkins, like alder catkins. The male part is I like the taste. It's crunchy. It's got to be full of protein.
Yeah, you said alder?
Oh, yeah, alder catkins.
Yeah. So, and not only that, alder is an amazing medicinal that people don't know about, and it's an amazing wound healer too. It's one of those, remember I was talking about herbs, there are one of the low-hanging fruit of herbs that move lymph, and any herb that does that helps our immune system in that way is usually topically also a great wound healer, because they tend to increase that microcirculation around the capillary beds that also have your lymph capillaries there, and they just increase all that garbage from a wound, right? Cell tissue and even microscopic dust and debris or whatever from the outside world that's in there that's too big to be sloughed off through our normal inflammatory, process from hydrostatic pressure on one side, on the arterial side, and osmotic on the other, and that capillary bed and those lymph capillaries in that area. There's something that happens where they speed that process up, and it's been shown that they increase macrophage and neutrophil count and activity in the area, sometimes doubling or even tripling that. Echinacea is a good example of this as well. And alder is one of those that does that. So it's a great lymph mover, a great wound healer. And usually we use the inner bark, but you can also use the catkins for that as well, bringing up catkins.
So having this information for the resistance or a partisan hospital, that if you look at the historical evidence of like there were three books that the MSIW at the Soma committee suggests: the Guerrilla Surgeon, the Black Scalpel, the Parachute Ward. They're all three fantastic. The Black Scalpel is my favorite. That they talk about the difficulty of setting up this hospital with one surgeon and a whole bunch of non-trained people that are trying to support that surgeon. They just lacked supply chains. There was so much hunger and starvation, and then let alone lack of pharmaceuticals and dressing, and try to improvise all of this stuff. This kind of information would have been helpful. And what's interesting is so many of these partisans are local, but they didn't have the information to bring in the food and the medicines on this guerrilla ICU. So they're holding patients, they're moving patients sometimes daily. So bringing food is a pain, and supplies and everything, and rebuilding everything. How could your premise, how could your thesis have helped those guerrilla surgeons in World War II?
Yeah, well, that's a great question. And I think you can even look a little bit, so post World War II, one example, in my opinion, that I know a little about, not much about, but a little about historically was the Baltic resistance and the Forest Brothers, which were the guerrilla fighters in, what was it, Latvia? I think Estonia was another place, Lithuania maybe.
Great.
Yeah.
There's great museums. I've been to all three countries. They have fantastic museums even now.
Oh, great. Yeah. And I've never been there. Yeah. And then that's an example, I think, also of having to have these decentralized, kind of movable ICUs that you could do this with. Now, I mean, while we can certainly talk about the herbs and getting the food from the land around you and sustainably, then that's absolutely a thing. There's so much more that has to go into a general idea of an ICU and medical care. And it's funny because this comes full circle to where when I first started this school, it was called the Human Path, and it still is to some extent. It's the Herbal Medics Academy, and that's a different story. But the Human Path was the original name, and there were 4 specialties. 5, but one of them was kind of an invisible specialty of leadership and teamwork. But there were 4 specialties, and I modeled that around the special forces concept, albeit for my purposes, for medical, like off-grid medicine is what it was all modeled towards. And those 5 specialties, or four specialties that everybody learns, and I had a course called the Core Basic. It was a 5-day sort of survival course where each day you learned a new specialty, were off-grid engineering, and this became the backbone of our Herbal Medics outreach organization, going to these different places where we would first set up slow sand water filtration to just get clean water. You can't run a clinic without clean water. So clean water was a must. And then all of the different structural things, kind of what the SF engineer, has to understand as well, how to build structures, how do we get a roof over our head, and how do we get a floor under our feet, and hopefully some walls, and how do we function, and how do we use mechanics and mechanical advantage to be able to create what we need, right? That's the off-grid engineer. And we did some really cool projects using, as a part of that. And blacksmithing was even a part of that too for us, And then the medic, of course, the medic that goes without saying, obviously. And then the third was the provider, what we call the provider. And the idea behind that was twofold. One was, how do we provide the food for our team? How do we keep our team well fed? And the second was, we need medics for our medics. So we'd switch these roles every day, right? And when we're in the field, wherever we were, Nicaragua or whatever, we have switched roles so that everybody gets a chance to be a team medic for the medics, because you get medics to get sick, and you got to watch out and make sure everybody's doing what they need to do. And we need to make sure we've got our food prep. We bring all our own food with us, or we buy it in the, local economy, and then we make it ourselves. But that was our provider. And then the fourth, and here's where, really, I think talking about things like the Baltic resistance and decentralized ICUs is the scout. The purpose of the scout is basically to collect information or intelligence. You cannot underscore the idea of information and intelligence enough, especially if you're talking about trying to run guerrilla level operations that have to do with medicine. Because as you mentioned, you might have to pick up and move. And we even use this when we were doing post-disaster help. We have students that are able to volunteer from all over the country, all over the world, if they want to take shifts in our dispatch. And we have our commo teacher, who's also he's a former 82nd Airborne retired guy that was commo then, and he's a ham expert, and he would run our dispatch, or still does run our dispatch. And that's how we would collect information for just being able to figure out where we were going to get gas when we were driving from San Antonio to Houston. And every single gas station is overrun with people having fist fights, because of rumors. And so there's because of the human response, not because of the disaster itself. So that kind of intelligence would be an example of it. Obviously decentralized in a wartime, you're going to have all kinds of stuff going on there too. And I think that, to me, and maybe because I was in the Army twice. My first time, I was prior service when I came in for SF, and I was a 97 Echo or 96 Charlie at the time. That's what it was called. It was an interrogator. So I went to interrogator school at the age of 18, and then language school, DLI, and got German, and then, worked as a German linguist, basically in a human intelligence collection, in civilian clothes over there on what used to be the East-West German border for 3 years. And I think that really nailed into my head how important the idea of intelligence collection is to be able to do anything satisfactorily in any kind of an austere or certainly in any kind of a, under unconventional warfare situation. Even if you have 95% of your people completely committed, that 5%, there's going to be somebody somewhere who's a leak, so you really have to have a decentralized situation. You really have to be able to respond. You have to be able to move people on a dime. And that means you need scouts out there figuring out where your next locations are going to be. So back to Hurricane Harvey, our scouts are out there, and again, students that are rotating every day to find where's our next location going to be for our clinic for the next day. And so it's a constantly moving clinic situation. And I think that even just practicing that for something that's not in a warfare situation, but in something where we're providing help for a population, for something like a post-disaster, is a great place for special operations to be able to get these concepts down into an SOP that works no matter what you do and in what kind of an unconventional warfare ICU situation you're in.
Yeah, there's a profound crossover through the concepts of unconventional warfare medicine and disaster medicine. The similarities are similar. So you can train for disasters medicine, and that will cross over into resistance healthcare.
Exactly. So, and then also you find, I think, some similarities. Of course, we're not talking about gunshot wounds necessarily. Hopefully, maybe a little, but not much. But things that are going to be more common. I always assumed it was going to be upper respiratory tract infections and so forth. And it was, a lot of times, because you get there like a week after and people are already getting URIs and from breathing in mold and stuff, from all the wet and mold that's everywhere. But aside from that, I would say probably the leading issue that I found in most of our post-disaster help was generally going to be some kind of musculoskeletal trauma, where from sprains and strains to even, to minor fractures and things like that you'd find.
So let's discuss how this will work. So we find a remote location that's safe-ish. We set up our Guerrilla ICU, and we find a location that's concealed, that's suitable, egress and ingress. And you mentioned scouts. So we have a local system that's in place to help us out, and we find a water source, and we limit our visibility and signature and EW signature. We have our medical supply. We have our M9 bag. We put that down, and now we're setting up our clinic. And your premise, your thesis is, at that point, you can start supplementing the pharmacology, the pharmaceuticals that we have with wildcrafting herbs. So how would that work? So first off, tell the listener what exactly wildcrafting is, and then how would you set this up for this first Guerrilla ICU?
Sure. So wildcrafting is gathering or harvesting the plants in the wild. So it's like a step between having them that you're taking in with you and growing them. So beyond that, the next step out would be wildcrafting them in the wild, which means you need to be able to identify them, of course, and know what they are. So yeah. So the good news about wildcrafting, in my opinion, is you're not going to find that plants are certainly bioregional, of course, but usually it's more in a temperate zone all the way around the globe. So in other words, some of the plants I've already brought up, you're going to find in the same temperate zone, whether it's in Africa, whether it's in Eurasia, whether it's in Europe, whether it's in the US, you're going to find the same weeds growing, right? So it's a matter of being able to identify those plants and then know how to use them. So this is the thing about herbal medicine. It's so much more complex than learning pharmaceutical medicine, in my opinion, right? Because you're not specializing in one little path all the way down. And I'm not saying that Western pharmaceutical medicine isn't complex. It's very complex. But I got into med school at the age of 42, and I had to choose between med school or family, and I walked away from med school. But, I did the work to get there. And I understand. I mean, I was able to really make that comparison. So when I compare it with herbalism, it's like you need to know a little bit of botany. You need to know a lot about about medicine making and how you do that, and what your solvents are going to be best for certain plants. You need to know how to prepare the herb in the first place, and then how to take it and how to apply it to the body. How do you get the herb to the tissue? This isn't a pharmaceutical that's been tested that you can take orally or whatever, and we don't have IV capability. So we have to think about intranasal. We have to think about through the ears, through the tissue of the mucosa, of the mouth, and sublingually and buccally. We need to understand how to put it dermally on the skin itself if that's what we're looking for.
There are some inflammatory type things we could take orally, but you're suggesting a poultice would be a better option.
Yeah, generally trying to get it to the skin, the surface of the skin. Cellulitis is a great example because it's so difficult from an herbal standpoint. And I've dealt with cellulitis in the middle of the jungle with no pharmaceuticals, and I've dealt successfully with it, several times. And the key component is, how do you get the herbs into the bloodstream in that area, right? And yeah, either through the directly around the wound itself or around the, and a lot of times, as you know, you're not even going to see a wound with cellulitis. Maybe somebody scratched, a bug bite, 4 days before with filthy fingernails, and there's not even really anything on the surface, and it's non-pus, it's not going to form pus and give you any kind of an abscess even a lot of times, depending on the type of bacteria. So the question is, how do you get the herb into the tissue? And especially in a distal extremity where it's hard to get herbs into the bloodstream around there. You're not going to be able to take it orally and expect it to function the same way that taking something like amoxicillin would do.
So we'll do a deep dive on our third podcast about the medical side of this. But for now, what's the next step? How can we create a learning pathway for the remote medic, the 18 Delta, the NSOCM, to learn what plants are available in their location?
Yeah, that's a good question. I mean, I think first, some of the basic principles, as I mentioned, it doesn't have to be as complicated as trying to find only the plants that grow in this particular area of Europe, for instance. It's more of a temperate zone thing. You're going to find plantain, you're going to find amaranth, you're going to find purslane, you're going to find, a number of different medicinals as well, dandelion and certain medicinals you're going to find over and over again in that same kind of growing region between whatever it may be, and that's probably more important to just know that and know how to identify them. And the route through that is an education. That's pretty much what we call our austere program in my school, which is, it's a nonlinear path. I feel like, you have to learn a little bit, like I mentioned, of botany. You have to learn a little bit of plant identification. You have to learn a little bit of obviously, SF medics already know this, but, you do have to learn something about clinical medicine and intake and so forth. And then you have to learn how to create the medicine and get it to the body. It's not just a matter most of the time, unfortunately, of just walking up and picking a leaf and starting to chew on it. Now, there are times where you can do that. I mean, there are certain plants and for certain things you could do that. And for gut stuff, a lot of times and nausea and things like that, we can get an effect that will be useful that way, or even sometimes for hemostasis. There's a great example of a weed that grows all around the world, highway weed anywhere in the U.S. just about, is Canadian fleabane, Canyza canadensis or Irregular canadensis. And that is, again, another plant that is just amazing at stopping bleeding. It would be, if I had to, God forbid, but if I had to figure out how to deal with internal bleeding from something like a gunshot wound or a ruptured spleen or something of that sort, this would be the first plant in the U.S. or anywhere in this temperate zone around the world that I would probably turn to. And literally, you could chew the raw leaf, and I've seen that happen for certain types of bleeding, and stop it in a matter of minutes. And I have some pretty cool clinical stories about it. And I've used it for ulcerative colitis and that type of bleeding as well. So there are some plants, sorry for the little tangent there, but there are some plants where we could literally chew the leaf. But many of them, we need another way to get them to the body, which means we need to extract that medicine through either alcohol, like for instance, just, straight up 40% like vodka, or water, or boiling water is kind of the universal solvent that's, for most things, it works pretty well, as a decoction or as a poultice, and drying it, cutting it up, macerating it, getting it to the point where we can actually have the interaction between our tissue and that herb.
Yeah, there's a lot of research on the what is the styptic capability of some of these plants to help with bleeding.
Right. And so I think, and of course, that gets really overblown a lot in terms of its importance, in my opinion, because as you and I know, the best way to stop bleeding is direct pressure and a good compression dressing, hopefully, or, a tourniquet if you have to. But we deal with this, for instance, in the austere program. And Steve Pearson, who is a former 18 Delta as well, and has been a rural doc for, 40 years. He's also emergency board certified. And we have gone through and tried to create our own. How would you deal with this if you had to throw a tourniquet on and you did a high and tight or something just to save a life? And then you're in a green zone and you're able to deal with this, and there's no higher care. There's no operative care, right? There's not going to be a surgeon anywhere for days or maybe weeks or maybe ever. You don't know. How do you save that limb and maybe even that life? Can you convert that tourniquet? And the short answer is probably, but you're going to need a styptic in this case. You're going to need either some sort of a powder that's made for this, or you're going to need plants that will do this. And there's a lot of plants that you could use for this, where you're going to have a styptic powder once you reopen that, that wound, and try to, if you're not going to be able to do some minor vascular surgery yourself, for instance, and then be able to convert that hopefully to something to where you're going to save that limb. So that's an example, for instance, where a styptic would absolutely be indicated. I think also, we get kind of all blown out about like, oh my gosh, yarrow is it stops bleeding. And it does, of course. Many, many astringent plants out there work that way, work incredibly well that way to stop bleeding, but so does just basic direct pressure and a decent bandage if it's a venous bleed especially. So the place where I was talking about, one example of this was I was on a Navajo Nation actually, and I was doing a kind of a survival / herbal medicine class, and we were doing a little plant walk, and there was this young man who got this nosebleed in the middle of it, and we were standing right around a patch of Canadian fleabane. That was the next plant I was planning on talking about. I totally hilariously, ironically, or whatever, or serendipitously, whatever you want to say. His mom apologized and said, man, he's had some different surgeries. He just gets these, and when he gets one, they just won't stop. And he's sitting there and it's just like his nose is pouring blood. So, get him to be able to, we put some direct pressure on it and so forth. And then I say, well, you know what, let's try this, and he starts chewing a Canadian fleabane leaves, and it's an aster family, but it actually tastes like a mustard. It's got a spicy kind of taste to it. And so I had him not just chew it, but also kind of put a wad between his cheek and his gum and just let it sit there like that. And I'll be darned, man, his bleeding stopped within a couple of minutes. And his mom's like, this never happens. And so then, they started using it. And I got note through the person that has set all this up. About 3 weeks later, he's like, I got to tell you, man, that guy's mom let me know that he's been using this. And he has not had a single problem since. It stopped. Nothing has ever done this. So, my point is that we have the ability to use plants in this, sort of, magical way almost when they're right out there, and we can just take them right off the plant. But most of the time, we're going to find that the clinical efficacy of the plant really needs to go through a step of medicine making, where we're using, different solvents and so forth. And this is something that, we'd have to be part of an ICU, an unconventional warfare ICU. We'd have to have sort of a medicine making lab, if you will, the sort of portable with the, and it's not much. I mean, we need running water. Ideally, we need some form of heat, and we need some stuff to be able to boil. Anything you could use to cook food is what you could use to make medicine with. It doesn't have to be complex.
Nice. So we just use the kitchen when they're not making food and we're making medicines.
Exactly. Yeah.
It is important to acknowledge that the Guerrilla Garden is there as a supplement for the supplies. If we look at this as a good, better, best, the best option, of course, is having a robust resupply of network to get the best pharmaceutical options for your guerrilla army, for your guerrilla ICU. But if you run out of supplies, or if you have those big hitters, you can save those for the major problems, the systemic sepsis or something like that. You can supplement with these herbs for some of the minor stuff. And we have science behind these plants that the medic on the ground can plan for this. Well, they need to go to your class, don't they? They need to learn what medicinal plants are available in the area. And SF group has their own AO, our own area of operation as first group. So ours was Korea. So if I ever went back in, or if I had to do this over again, I would focus on what plants were there on the DMZ of Korea, because that was 10 deployments on the DMZ again and again and again. So it is possible to learn the plants of your area before you get there.
Absolutely. That's a given. It's not hard to be able to do that. And that information is readily available as to what's there. It would be very easy to be able to create a large materia medica based on temperate zones.
So as a wrap up of this first episode, we discussed the need to create a guerrilla garden. And we talked about Sam's book that laid that out in 3 layers, the first 5 days, first 5 weeks, first 5 months. And this is to supplement your resistance healthcare system. And the next 2 episodes, we'll do a deep dive into edibles and then the medicinal plants. But for the moment, Sam, thanks for taking time to chat about a guerrilla ICU and to see what kind of options are available to supplement the healthcare system.
Yes, absolutely. Thanks for having me, Aebhric. This was fun.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.ca. www.edu.mt.